Hi, everybody. I'm Dr. Jane Georges from the Hahn School of Nursing at the University of San Diego. Recently, our School of Nursing was asked to speak at the Achievement Rewards for College Scientists, ARCS, annual membership meeting. Our PhD program in nursing science is funded by ARCS scholarships, and we were delighted to take part. They asked us for 3 presentations, one from me, another from a current ARCS scholar who's in our PhD program, Brooke Rakes, and the third from one of our faculty, Dr. Carolyn Etland. Dr. Etland is in fact a past ARCS scholar. She is an inaugural Kay Woltman and Melissa McGuire Hospice and Palliative Care Education and Research Fellow at the Hahn School of Nursing. We've placed these 3 presentations on our website and on our social media sites because we want to express our deep appreciation of all our donors. Thank you for making this once very small nursing school on a beautiful campus on the Hill into one of the most cutting-edge, innovative schools in the nation, allowing us to produce the type of compassionate, extraordinary nurses who will revolutionize healthcare. Thank you for joining us. Hello, everyone. Thank you so much for inviting me to speak to the ARCS Foundation San Diego. It's been both a privilege and a pleasure to work with the leadership of the ARCS San Diego chapter. Since I assumed the deanship of the Hahn School of Nursing at the University of San Diego 2 years ago, I have been delighted to be involved with the wonderful members of this organization. Working with Helga Moore was very inspiring, and I look forward to working with Holly Heaton and all of you to empower more of our college scientists. I want to tell you who we are and a little bit about our school. With your help, our school is preparing nurse scientists to create those solutions for a healthier world. We are so very grateful to be an academic partner with ARCS, and we're proud to take our place beside UCSD, San Diego State University, and the Scripps Institute in this endeavor. At our school, nursing is our profession and our passion. We find ourselves today in a very different world from a few months back. The COVID pandemic has changed all our lives in many, many ways. At no other time has the work of professional nurses been more important to our nation's health. But also, at no other time has the work of ARCS been more critical. Your work is part of an important lifeline for us to train scientists who can begin to create solutions, not just for this crisis, but to build a healthier world in the future. The Hahn School of Nursing at USD is the largest provider of nursing graduate education in San Diego. We are a school dedicated to excellence. We build on a strong track record, producing many of the nurse researchers, nurse executives, and nurse educators in our city. Our school does it all. We offer programs to prepare entry-level nurses to be at the front lines. And right now, some of our graduates are caring for the sickest patients in San Diego in every ICU, in every hospital in our city. Those frontline nurses are our heroes and our healers. But the complexity of healthcare now also means we need nurses who become scientists also. These frontline nurses need the work of nurse scientists to find ways to test and implement the best ways of saving lives and promoting health. So let me tell you a little bit about our preparation of those nurse scientists whom you support, and exactly what ARCS is doing to help them, and why I am so grateful for our partnership with you. The University of San Diego established a doctoral program in nursing in 1985. It was a bold move because at that point, the idea of nurses obtaining doctoral degrees and becoming scientists was new. Since that time, our PhD in nursing science program has grown and flourished, and it's been my privilege to teach in that program as a professor for the past 24 years. So, what kinds of scientific exploration do nurse scientists do? Well, you'll hear in a minute from one of our graduates and one of our current PhD in nursing students. I think you will be struck, as I always am, at how these very bright students and alumni do scientific work in distinctly human areas. A lot of nursing science is both high-tech and high-touch. We look at real-world health problems inside the hospital and outside that can make a real difference to our patients' lives. Our School of Nursing focuses on 4 specific research areas, which I'd like to describe to you briefly. I'm not presenting them in order of importance. All of these are of deep concern to us as nurse scientists. Our first research focus is palliative care. For example, we want to make the experiences of patients and their families more positive when living with chronic illness. That's what palliative care is all about. In the future, post-COVID world, palliative care research will have an enormous importance for those who have survived this terrible infection or whose lives have been changed forever by it. Later, you'll hear from Dr. Carolyn Etlin, a past recipient of an ARC scholarship on her palliative care research. Our second research focus is military and veterans health. We also do research which supports the health of our armed forces and our veterans. We're proud to partner with the United States Navy and the Veterans Association to find answers to how to keep our troops and our veterans safer. We provide research training for Navy Nurse Corps officers who then use their abilities to improve combat readiness and provide the best healthcare possible for our servicemen and women. Our third research focus is maternal child health. Our faculty and PhD students do research helping moms and babies get off to a healthier start in life. You'll be hearing from one of our ARCS scholarship recipients in a few minutes about how we can make nursing care in the NICU safer for babies. Our fourth and final research focus is older adult health. Our PhD students have produced research that has had a direct impact on helping our oldest Americans receive nursing care, which maintains their quality of life. As Americans live longer with more chronic conditions, we need this research. So I hope you're getting a sense that nursing research at our school is focused on all human needs, from the oldest patients to our tiniest ones. As nurse scientists, we're committed to enhancing the science guiding healthcare for all Americans. As I close, I hope you will take great joy in knowing that your ARCS chapter has supported many of our PhD in nursing students who have gone on to do important scientific work. I can think of many of our past students who would not have been able to finish their PhD without ARCS support. They're often our best and the brightest, and they have the potential to make American healthcare safer, stronger, and more responsive to human needs. Now, I know often during this COVID crisis, we've all felt like we're not doing enough, that we wish we could make a real difference in what is happening in our hospitals. Let me assure you ARCS is making a real difference. You can take great pride in what ARCS San Diego has done in supporting the nursing profession in San Diego. Your efforts are felt every day in every hospital in San Diego as our ARCS scholarship alums are doing research that helps nurses fight this pandemic. In a very real way, you were on the front lines with our nurses. So on behalf of the University of San Diego, I want to thank you for the privilege of partnering with ARCS. And because of ARCS, I'm optimistic about our future. We can find solutions to healthcare problems, and it's your efforts that make this happen. So in closing, on behalf of all San Diego nurses, from the bottom of my heart, thank you to the San Diego ARCS chapter for all you have done for nurses. Thank you.